Derek comes from urology. He knew this pain too well. He can't golf with a lot of his friends or hang out with them because they're doing pre-charting, they're catching up on their charts.
A lot of my friends who are urologists are also golfers. They're constantly late. We call it trunk slamming, where they would come in, grab their clubs, slam their trunk, run to the first tee, no warm up. What is it about your job that makes you constantly late? Why are the urologists not getting to be urologists? Why are our doctors data entry people? Why are the doctors doing the work that they didn't go to school for?
I see the problems every single day. I see the problems, like my MA's burnt out, I'm getting burnt out, my patient wants more time with me. I got like 100+ clicks to do just on that one patient.
For the average office visit, we're seeing upwards of 117 clicks with some of our users, and now this goes down to near zero. They spend all the time looking the patient in the eye, and we automate the whole process. So we call it EHR Autonomy. It separates the doctor from the EHR and gives them their lives back.
Viscera Health removes the doctor from the documentation process. We automate the documentation process. Some reason, around 2008, we decided as a community that doctors should be the data entry person for the EHR. That was the wrong decision. And since then, the doctors have had to figure out a way to spend all of their time in front of a computer making sure that their documentation is done. Viscera Health stops that.
Half of medicine is in private practice, and the tools they have are near non-existent. The EHRs are 1990s, early 2000s folder-based UIs. None of them were built to the workflow or for medicine for that matter. The EHRs have never asked to see a procedure, never listened to an office visit. They don't even know the workflow they created for their users.
It's essentially taking the manual labor that a physician does that is unnecessary and eradicates it. So this product makes it where I don't have to type and I don't have to click. And I didn't need to do that anyways. That never made me a better physician. It made me a worse physician.
So what Viscera does is add that vitality back. It adds that life back into medicine. It actually makes me want to be a doctor again.
The time is very easy to quantify how much this saves. But what's not easy to qualify is how much this improves the quality of life. I can go home and I can be refreshed and I can show up and be present and I can participate in my children's lives.
We're going to make it better to run a private practice than to just take a job at the hospital system.
Looking that patient in the eye, looking the family member in the eye, and being able to provide true health care.
Let's have the doctors seeing patients, not the doctors as data entry people.